Ladies and gents, welcome back. It's been well established that in Canada, we have a two-tiered medical system. First, you go to the public option, and then when that fails you, you drive down to the United States and seek medical care. Now, all joking aside, in Canada, we have universal medical, and we're seeing more and more these days that universal medical for all citizens and residents of Canada is not so universal when it comes to the status of your vaccine. Now we have this story from CBC Edmonton. Charter not violated in denying a transplant to a patient who refused COVID-19 vaccine, court rules. This is ruled by a court. Woman was diagnosed in 2018 with chronic progressive disease. Now there has been a publication ban on this. So there's a clarification. Previous version of the story included more specific details concerning Annette Lewis's medical condition. That information has since been removed due to court-ordered publication ban. It is not unconstitutional to refuse an organ transplant to a woman who refused to get the COVID-19 vaccine. An Edmonton judge has ruled. Annette Lewis went to court seeking to preserve her spot on an Edmonton-based transplant program waitlist after doctors told her she would not be eligible because she is not immunized against COVID-19. A decision filed Tuesday, Court of Queen's Bench Justice Paul Belzil dismissed Lewis's argument that her charter rights have been violated. So you do not have charter rights to healthcare. Interesting that, because in Canada, well, let's look at this. This is from healthing.ca, Does private insurance fit with Canada's health system? In Canada, private medical insurance does not exist. Our healthcare system does not allow paying with private health insurance for any hospital services that are medically necessary. It is illegal for patients to pay out of pocket, to skip long wait lists for a surgery, and physicians cannot accept payment from patients who want to see them sooner. Now, to be clear, we're not talking about the private insurance that covers dental, vision, and prescription drugs. Private medical insurance in Canada would aim to provide an alternative option to waitlists and providing faster and better options for currently covered elective procedures. And that's really important here. Now, getting back to the story, this judge, he ruled the charter has no application to clinical treatment decisions, and in particular, has no application to doctors establishing criteria for organ transplant. There is a publication ban on identifying the specific organ. So they're saying here that it's a fundamental right for all the citizens, but it's not protected by anything. That right is at the whims of a doctor's decision, whether or not to kick you out and say you're SOL. You have no other option here in Canada. Lewis was diagnosed in 2018 with chronic progressive disease with no cure, no specification because of the publication ban. Doctors told her a transplant was her only hope of survival. After extensive testing, Lewis was deemed healthy enough to qualify for a transplant, according to details in Belzil's decision. Beginning in 2020, she was advised to get a series of vaccinations, including childhood vaccinations, as her immunization history could not be located. She agreed and got all the vaccines. But in March 2021, she was told that she required a COVID-19 vaccine in order to receive her transplant. She refused. So she's not anti-vax. She got all of her immunizations, and then she was offered this extra one to which she refused, which by all means is an emergency order medication. Let's just call it that. Taking this vaccine offends my conscience, Lewis wrote in an affidavit filed with the court. I ought to have the choice about what goes into my body, and life-saving treatment cannot be denied to me because I choose not to take an experimental treatment for a condition, COVID-19, which I do not have and which I may never have. Scarcity of donors, risk of COVID-19 factors. In response, Alberta Health Services and the doctors and hospitals involved in Lewis's case filed evidence about how the transplant program works, how patients are chosen, the risks of COVID-19 infection to a transplant recipient, and evidence that COVID-19 vaccines are safe and effective. The names of the doctors and the hospitals were redacted from Belzil's decision. The transplant program in question provides services for patients in Alberta, Saskatchewan, Manitoba, and eastern British Columbia, Northwest Territories, and parts of Nunavut. Decisions to add a patient to the transplant lists are made by a committee of medical experts who consider the recipient's severity and need and likelihood of survival. Sounds a lot like what they were talking about a few years ago about panels down in the US when they were worried about socialized medicine coming to the United States. They were talking about panels of people making decisions on whether you stay or whether you go. Court heard that because these organ donors are scarce, 1 in 5 people on the Edmonton waitlist die before getting a transplant. This is the sad state of our medical system. Honestly, this is how bad it is. A patient can be rejected if the transplant would unacceptably increase the patient's risk of death without a meaningful chance of improving the quality and duration of life. Once the COVID-19 vaccine became available, specialists with the transplant program determined it was in the best interest of pre-transplant candidates to be vaccinated because of the significant risk to COVID-19 presents to highly immunocompromised transplant recipients. Court heard that during the fourth wave of the pandemic between September and November 2021, nearly 40% of the similar transplant recipients in Edmonton who were infected with COVID-19 ended up dying. This is the reason for the decision. Bezel agreed it was beyond dispute that Lewis is the sole decision maker about what goes into her body, and she is entitled to her beliefs about vaccines. This is the most egregious coercion yet that I've heard. We've all heard the stories of get this experimental product, or you may lose your job. Get this thing, or you may lose your benefits. But now you may lose your life over this. I do not accept, however, that her benefits and desire to protect her bodily integrity entitle her to impact the rights of other patients or the integrity of the transplant program. Generally, the judge says, no one has the right to receive organ transplants, and no one is forced to undergo transplant surgery. Now, we're not arguing about forcing people to undergo transplant surgery. I don't see the logic there. We're talking about saving lives here. Belzil also found that if Lewis's application were successful, it would have significant negative public policy implications be unfair to other patients and disrupt the transplant program. Interesting. The proposition that that treating physicians exercise clinical judgment would be subject to the charter would result in medical chaos, with patients seeking endless judicial review of clinical treatment decisions, Belzil said. So, well, what is he getting into here? He's saying, I don't want to see any more of these cases. I don't want this to be litigated in the courts. We want this to be decided by a panel of doctors and leave it there, giving patients no other options in what we otherwise have always seen as a free country. We don't have the freedom of getting medical service. Now, this would be all fine if we were a country that had a private option where we could go and get our service from somewhere else, but we don't have that option in Canada. Very sad story to bring you guys this morning, but this is the nature of it. This is the This is the reality in Canada. We have a single tier system. I was joking at the beginning of the video, but most people do end up fleeing to the United States to get service, or other countries around the world to get service, medical service, life-saving medical procedures that would be available here if it weren't not for the terrible service that is available here in Canada. But let me know what you think. Leave a comment in the comment section down below. Also, don't forget, tonight we will be live streaming at 6:30 Pacific time. That'll be the usual Friday night live stream where I catch up on all the stories that I couldn't get to and more details on the ones that I did cover. So tune in to that. We'll see you Pacific time, 6:30. Check your local listings, and we'll see you then. Keep on trucking.